Everyone.
Good afternoon.
Good afternoon. It's a tough thing to follow. Just before I start, I just wanted to acknowledge my fellow travelers in this journey. This journey is about sharing our lessons learned, sharing our failures and the pivots that we've made. The two people I want to acknowledge on behalf of whom I'm standing is Ankur, who was my co-founder, and Garima Gupta, who also is my CEO, the Chief Emotional Officer in my life, but being part of my journey right through these 11 years. So, just a quick introduction to Swasth Foundation. I think it's new. We've been part of this cohort for Innovations Healthcare for 5 years now. And I think just to give a sense, the green one. Okay, yes. So, brief introduction. We are a not-for-profit social enterprise. It was founded 11 years ago in 2008. Our commitment is to health and joy for all. So that's our commitment. What we do, very quickly, we operate a network of about 30 plus primary and wellness centers for urban poor in India. Right? So that's essentially what we do. And lastly, what we've been able to do in the last 11 odd years is serve about 1 million health interactions. Where we focus in, I was very glad somebody spoke about financing and savings, but we've reduced close to $2 million of out-of-pocket expenditure of people. And we do track that very regularly with a customer satisfaction of 4.2 plus. Right? So just managing that low cost, low price points, reduction in out-of-pocket expenditure and maintaining the quality patient satisfaction. So that's in very short of who we are and what we do. I'll move quickly to what have been our learnings in these 11 years. So we've made 3 key pivots in these 11 years, and I think the first one happened 3 years, pretty much very early, 2011. We were still not part of innovations in healthcare, so you will see the shift is a very basic now one-on-one kind of shift, but we do wish we were part. We would have made that mistake in some ways, but moving from micro health insurance to primary care. So we started off working in micro health insurance, and in 2011 we moved to primary care. I'll talk of each of the pivots and the significant changes a little more in detail. In 2015, then we shifted from being a for-profit to a not-for-profit. So we started off as a for-profit social enterprise, and in 2015 we made a choice to move to being a not-for-profit social enterprise. And now, this is a pivot which is pretty much ongoing. It's sort of reaching a stable point now, I think December 18. And so Jan onwards, we are moving on this new journey of moving from healthcare to health. And that's something I'll talk to you more about. So these have been our 3 key pivots. The first one, from micro health insurance to primary care. So what was that about? So when we started playing a role, and that's the background of me, Ankur, the co-founders, we were management consultants. So we started with saying, how do we integrate existing providers? Why create if there is infrastructure, right? And in India, it's not, particularly in urban, it's not infrastructure is not completely absent. There are rural parts of India where it is absent, but in large part it's there. So can we integrate the setup and work with existing providers rather than starting off on our own? And hence play a more like an intermediary role where we are partnering with non-profits, community-based organizations on the consumer side and integrating the provider network on the back-end side. I think during the 3 years, we ran a pilot of microinsurance across 200 villages, had about 20,000 people enrolled, etc. But at that point, 2 things happened. One, and largely one, but our partner, the community partner, decided to sort of move on and said, okay, this is not working. They decided sort of on their own and decided to move on. And at that point, that was a big shake-up for us. So that sort of triggered, what shall we do now? And then we started also looking at our data. So when we started looking at what happened with insurance, we had seen a renewal cycle, etc. So the first insight that came, which was now sort of healthcare 101, and that's why I wish we were part of the IIH before. And that was just focus from, instead of building an integrated network first, just have standardized primary healthcare. Right? So without a good foundation of standardized primary healthcare, you really can't build a healthcare system. And that was our first learning, and I think now it's pretty much, as I said, 101, so not deep inside. The second was business 101, which was build an identity with your community, with the people you are serving. So the way we were working before that was, as I said, being an intermediary, working with the non-profits or other community-based organizations. So the community didn't know us. So when sort of our partner decided to say it's enough, we really didn't have a choice but to exit that geography. And so that sort of got us there. These two together sort of lended itself also to merge very seamlessly together. So when we started saying we want to run our own primary healthcare centers, it allowed us to also build an identity with the consumers directly. So that was our one big shift. So just moving from an insurer-like mindset or an integrator to being a delivery care delivery. So then we started with a couple of pilots, ran a few centers, 3, then moved on to 10, scaled it up to 15, and around 2015, we had another sort of situation where the choice was how do we move ahead from there, how do we scale further, right? So the choice there was, and we were starting to look at for-profit versus not-for-profit. So what we were a for-profit enterprise, and the choice that we were seeing was, as a for-profit enterprise, at least our learning was, you are meant to be profit maximizing, right? You have your accountability to your shareholders. And what shareholders want to see is profit ultimately. They can be patient at best, but they do want to see profit. And yes, for them, it's profit maximizing with social impact. The other thing that happens as a for-profit, naturally, we realize is scale is important. So it's scale with quality. So quality does come as an add-on to scale. So it cannot be at the cost of scale. So that was the choice we were seeing, and I think when we introspected, what we realized was this first thing, that for us, for me, what mattered more was impact. So we wanted to be an organization which focused on impact maximization, but at the same time be sustainable. So business has its role in itself, but be an impact maximizing organization which is sustainable, and be sustainable and not look at the other side. So I think that was a very important choice for us at that stage. And the second aspect was looking at quality differently, in saying we wanted to make it accountable quality. I think in the Indian context, it's very important, where accountability in healthcare as a way is almost non-existent. I can't say anything besides that. So in the last, I think, till about 2 years ago, just as a fact, at least 2 years, the last I checked, not a single physician in India has ever lost a license or been reprimanded for any kind of lack of negligence or quality of care. So I can see that and be proud of my country that we have the best physicians. But reality is that the accountability systems are not as strong, right? So the accountability doesn't exist. So how do we now build accountability? So as we shifted this pivot, we made this change in our belief and started really thinking about how do we maximize impact. Our activities also started changing. So I think the couple of things that we started doing. So for example, for accountable quality, we started this whole system of measuring patient satisfaction, and more importantly, started holding our providers, our doctors, our dentists who are providing the service accountable to that. So their pay started getting affected based on what the patient outcome was, be it patient satisfaction, be it health outcomes, be it process compliance to measure quality. So then we started this whole journey around how do we measure quality, and given the context of India, we had to do it in a very collaborative way with all our physicians. And I really salute our physicians, our doctors and dentists who are at Swasth, who voluntarily accepted this and said, yes, we want to build a system which stands for quality, which stands for accountable quality. Because there was no regulation, nothing in the environment asked them to do that. The environment is very free for them, that they can really do what they want. But they chose and they said, we will build a system where we can, in a very objective way, measure quality. And we all will collectively stand for that. So we had our network of providers, our physicians, dentists who came together, defined a checklist which we supported them with external knowledge, centralized. And then they said, okay, yes, they signed contracts which said we stand by this quality. So that was a very important milestone, and that's the journey we started. Otherwise, really in India, even in the best hospitals, biggest branded hospitals, we don't see this level of transparency on quality or even accountability, definitely, where the providers are saying we will hold ourselves accountable to quality. So in fact, that encouraged us even a step further and said, how can we as an organization and the providers be accountable now to the patients directly. Right? So that was one big moment when what we decided to start was we started providing warranty for our health services. I think that was, we believe, something which is very new and innovative, really making it accountable to the end consumer. And that's a very simple thing, right? So for every device that we have, be it a mobile phone, a television, we get warranty, right? Which means if it doesn't work, then the provider will at least repair it for free. So you don't have to keep going back to the same doctor and paying out of pocket again and again, which is what happens in India. So we said very simply, any treatment you get done at our center, 3 years, at least for all our dental treatments, we have that. You come back for that tooth, you will never pay again for 3 years at least. So we give a flat warranty on every dental treatment. And that was very well received by people. Again, our physicians did that, and that really pushed us to say, okay, what's accountable quality? Really making it very transparent and accountable to the people. And allowing us this shift. It allows us to experiment a little bit. I think that's been our sort of 3-4 years. As I said, we are today at 24 clinics, and I think we started a journey during that process, particularly looking at chronic diseases, and that was a big part of our India. The situation is quite dire there. I think we found through our data above 40, 2 in 3 individuals either have hypertension or diabetes or both. Above 40. So so the situation is quite bad. It goes largely undetected. The only time the person gets to know is when there is a stroke or a heart attack and they'll end up in a hospital. And that's the cycle of impoverishment that continues. So we said, how do we now take it through our primary care network, really increase screening and all of that. And as we started working with people during this process, we realized we protocolize the care which is there. So we started referring people to the clinics. We found that yes, in our system we found high compliance relative to the market. We got about 50-55% compliance. The market is 25%. So we saw better compliance, but we're still seeing there is a large part which is not even coming to the center. They're not even starting their journey. So what's happening really? And I think as we started that introspection cycle, it resulted in what we see here. So, which is healthcare to health, right? That's the pivot that we are making now. What is healthcare? Healthcare largely becomes about provider control, right? So healthcare is the doctor, the pharmacy, the lab. They are really in charge, right? It's focused on curative. Once you diagnose a problem, once there is a problem, you go there and get the services. So get treated. Right? It's very provider-controlled, provider-centric system. To a large extent, I think what we realize, us as individuals, we have really also outsourced our health to our doctors and providers. Right? It's that level. We really become helpless. Right? Even the most educated, at best, we can get a second opinion. Right? So beyond that, or read up something on the internet. Beyond that, we are just at the mercy of the provider. And it's more and more largely what we call as Western medicine. So as we started looking at talking to people and seeing what they really wanted, the first thing that emerged was they really wanted a community empowered system where the patient, the community member was really at the center of it. It's where we want people to take charge of their health, not outsource it to a physician, to a doctor, to anybody for that matter. Right? So really take charge of their own health is to empower them with information. I think somebody was talking about it in the morning as well. There is information around it, but really around mindset, saying I am in charge of my health. So create a system which is focused on that. Wellness becomes a natural concept, but not even wellness in the common way we see it today. Because when we talk of wellness today, we think of a yoga center or a gym. Again, we are replacing one dependency with another. So the idea there is to really empower and see how can people take charge of their own health. And as we started digging deeper on how to make that happen, we had to sort of depend on our Eastern system, so the Indian and the traditional systems of well-being and wellness that exist. And I don't call them as health systems as much as wellness. These are the yoga, the system of yoga, Ayurveda, Unani, all these disciplines which have been there for thousands of years, have encoded a lot of knowledge and wisdom. So how do we bring that practically down? And this goes beyond postures, what asanas, etc. that we know. of in yoga. This is really around a way of life and how do you lead a life where you are in charge of your own life. And we said one of the big aspects of this pivoting, which we are starting the journey now, is to really integrate the Western and the Eastern. So it's not replacing, saying it's not Western. I think there's a huge body of knowledge that has emerged now from Western sciences, and it has its depth, it has its rigor, which is very valuable. How do we integrate that with what we know also? Right? So how do we bring those two together? And that's the model of our wellness center that we are piloting in some ways now and building that. So we are, for example, planning an RCT which is based on this discipline, on integrating this service together through a health coach, a community member who is a health coach, delivering some of these Eastern services and integrating with our clinic where the doctor is there. So for hypertension and diabetes. So how do we, and measuring systolic BP as the benchmark. So how are we seeing that reduction? Right? So bringing that integration is what our focus is now. So those are the three pivots that I think we've made. This one, as I said, is still emerging. It's done. I think we're just beginning to live this life now. Going forward, let's see what happens next. I think one of the things I did want to share as we make these pivots, what enabled us to make this pivot, because I think and that was sort of the mandate to me. So I just wanted to make sure we understand the pivot. So what enabled us? I think it's very important. Pivoting, even if you look at just the physical definition, seems like a very stressful exercise. Right? You're going in one direction and you're suddenly changing. And force equal to mass into acceleration. The bigger you are, it's harder. So how can we make it as smooth a process as possible? And I think there are three things that I want to leave you with. The first is this, which is maintaining a certain equanimity in failure and success. So really treating both failure and success the same, because both are opportunities to learn. Right? We tend to, some people value failures for learning and learn less from success, but there's a lot to learn from successes as well. What worked? And at the same time, the sorrow, the grief that you feel at failure is something that has to be also managed. And it has to happen both ways. We can't say we'll celebrate success and then just manage failure. Because the more we celebrate success, the more downtrodden we are when we fail. And that's been our experience. We just try and see both almost as equally as we can. I think it just enables us to come up with the insights. What is the message that's coming from that situation? The second is that it's not really a choice. It's about means and end, or the path and the goal. I often hear this saying, oh, the goal justifies the end, and that's a very common debate sometimes Elisa have been part of, and I think our learning has been that it's both. It's never either or. The goal is important and so is the path. If you don't go with the path that you are set out to, we find it's not sustainable, and that's what we have seen. That's where we have failed. We let go of the path, and then we reach the goal, but then the goal crumbles. It's not stable, right? Because the path was not followed. It's not as strong. The foundations are not strong. And I think the change, the only shift that we require to make this a reality for us is the timeline. Right? Saying the goal will not be achieved in the time that we think it will be achieved in say the 1 year, 2 years, 3 years. So we set it out. We haven't achieved what we set out for, but I'm hoping we'll do that in future when it is supposed to happen. So really thinking of both. It's neither or. It's path and goal. It's means and the end. And I think last one, which I think incorporates a lot, mostly all of this, is to discover the harmony in the choices. So at each of these stages there were choices. It's X or Y. But it was really for us to finally arrive at saying, how do we get X and Y? It's how do we build that harmony where it's not a choice that I have to pick X or Y. It's really see how where there is harmony. How do we bring these two together? How do we bring the means and the goal together, path and the goal, the means and the end, all of that together and move ahead. So it was about saying, for example, like I said, maximizing impact and sustainability. So how do you bring both the social and the financial aspect together and create a harmony which works for you? And it's not about right or wrong, it's really about what works for the organization and what works for us. So to me, that's really the summary of it, just discovering the harmony of what happens. I think Simone said each of these situations is an opportunity which is being thrown at us to find that answer, the premise of the book. I think that's pretty much I would say what we have learned, to discover that harmony. There is harmony in whatever is happening. We may like it or not like it, but there is a harmony there, and if we can discover that, it makes the journey smooth. It doesn't change the journey. It still is hard, but I think it just makes it smoother, and you still have fun on the way, which is the most important thing. So I'll end with our motto, written in Hindi for whoever can read. It means Swasth Raho, Anandit Raho, which literally means be healthy, be joyful. So that's my wish for all of you. Thank you.